To health, the Ministry of Health has today launched End Malaria Council that is mandated to see Kenya eradicate malaria by 2030. The 11-member council will also establish systems for malaria elimination in target counties, which are mainly found in the Lake Victoria region, the coast and highland areas. The council will also provide leadership and management for implementation of malaria interventions and also bridging the malaria resource gaps. 15% of Kenya hospital visits in the country are attributed to malaria, with the disease being the highest killer of children under 5 years. To mitigate this, the Ministry of Health, through the Council, will be supplying mosquito nets in 27 counties, targeting a population of about 27 million Kenyans, and also spraying of mosquito breeding sites.
This council is the fifth to be launched in the African continent after Eswatini, Uganda, Zambia, and Mozambique. It will play a very critical role in mobilizing local resources to drive the agenda of malaria control and elimination in Kenya in a much more sustainable way. There were 215 million malaria cases and 384,000 malaria deaths in Africa in 2019. The greatest burden, as was ably demonstrated here in the presentation, is in Busia and Siaya, where incidence is more than 6 times higher than the national average. Many factors account for this, but perhaps none so much more than the presence of extensive number of breeding sites near homesteads. To mitigate against this, we plan to accelerate efforts that will include application of measures to spray and kill mosquito larvae at the source in these counties during the second quarter of this calendar year. And to ensure that those two and other counties also address other aspects aimed at fighting malaria, His Excellency the President recently launched the use of malaria scorecard, which will aid health workers and community members in identifying factors that could be responsible for increased numbers of cases. Once these are identified, it will be easy then to develop effective and targeted preventive measures. Although Kenya continues to experience public health and socio-economic impact as a result of COVID-19 pandemic, I'm delighted to say that through commendable efforts by the government and its development partners, this predicted doubling in malaria deaths was averted. We ensured the continued distribution of insecticide-treated bed nets, the availability of medicines at our health facilities, and indoor residue spraying took place as planned, whilst COVID-19 protocols were being observed. By ensuring that all Kenyans, and especially children and pregnant women, have access to life-saving medicines, insecticide-treated mosquito nets, and other commodities, we took and indeed continue to take steps forward.
To the corridors of justice, the judicial